Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hepatocellular carcinoma versus the fibrolamellar carcinoma. Now let's look at HCC, that is hepatocellular carcinoma. So what is the male is to female ratio? The M is to F ratio is 2:1 to 8:1. So it is most commonly present in males. And the median age will be around 55 years. Next is the question on the tumors. So the tumor is going to be invasive. And what is the dissectability? Dissectability will be less than 25. Then comes the question on the cirrhosis. Cirrhosis will be 90%. Then AFP positive. So AFP positive will be 80%. And what about the hepatitis B? The Hep B. Hepatitis B is going to be 65%. Now let's look at the fibrolamellar carcinoma and how is it different. So in short, we are writing it as FLC. So fibrolamellar carcinoma, the male is to female. Here it is, there is no gender predation. It is not considered. So it is almost the same. And the median age if you see, it is about 25 years. In HCC it was 55 years. Here it is 25 years. Then when you look at the tumor is going to be well circumscribed. It is well circumscribed. Whereas in terms of the HCC, it was invasive. Next, the question on the resectability. So his resectability will be 50 to 75%. Then the question on the cirrhosis as well as the AFP positive and the hepatitis B positive. We are grouping it because everything has the same. So all this, it amounts to about 5% individually. To learn and grow daily like this, please do subscribe.